South Africa's healthcare system is split in two: a well-funded private sector for the few and an overburdened public sector for the many. The private sector boasts modern facilities and advanced technology, but serves only about 16% of the population. Meanwhile, over 80% rely on the public system, which is stretched thin and often struggles to deliver consistent care. This divide is rooted in a history of inequality, shaping health outcomes across the country. In public clinics, long queues and staff shortages are common, while private patients enjoy quick access to specialists and treatments. The quality of care often depends on income, raising tough questions about fairness and access. For many, the difference between public and private care is the difference between waiting weeks for treatment or getting it within days. This dual system isn't just about facilities, it's about life expectancy, quality of life, and opportunity. The challenge bridging this gap to ensure everyone has a fair shot at good health. This is the central issue South Africa must address to build a healthier, more equitable future. The numbers reveal the gap. Most South Africans depend on a public system with less than half the nation's health budget. Public hospitals face staff shortages, outdated equipment, and long waits, especially in rural areas. Chronic patients often struggle to get regular checkups or medication. In contrast, private healthcare, funded by expensive medical aid, offers fast, high-quality care to those who can afford it. Private patients enjoy modern hospitals, short waits, and access to specialists and advanced diagnostics. For many, geography is another barrier. Rural clinics can be hours away and often lack basic supplies. Reports highlight poor sanitation and crumbling infrastructure in public facilities, affecting both patients and staff morale. The result? Health outcomes are often determined by wealth and location, not just medical need. Policymakers are now looking to reforms like national health insurance to close this gap. As pressure mounts on traditional healthcare, wellness centers are gaining ground in South Africa. These centers focus on prevention, offering nutrition advice, fitness classes, stress management, and alternative therapies. They attract mostly urban, affluent clients who can afford to invest in their health. The approach is proactive. People seek to optimize their well-being before illness strikes. This shift contrasts with the reactive model of traditional healthcare, which treats illness after it appears. Wellness services target lifestyle factors, diet, exercise, stress, that drive many chronic diseases. South Africa faces a quadruple burden: infectious diseases, rising non-communicable diseases, injuries, and maternal health issues. Poor lifestyle choices, processed foods, sugary drinks, inactivity, fuel obesity, diabetes, and heart disease. These preventable conditions strain both public and private healthcare. Wellness isn't just a trend, it's a crucial part of the health solution. The answer isn't choosing between medicine and wellness, but combining them. Imagine a patient with high blood pressure medication from the clinic, plus a referral to a wellness program for diet and exercise. This integrated approach tackles both symptoms and root causes, improving outcomes and reducing costs. Doctors can socially prescribe wellness activities, like walking groups or cooking classes, alongside traditional treatments. For this to work, healthcare professionals need training and strong links to wellness providers. Prevention frees up resources for urgent care and helps patients take control of their health. Building a healthier South Africa means making wellness part of everyday healthcare. By bridging the gap between treatment and prevention, the country can move toward a fairer, healthier future for all.